Ultrasound trainings, Introduction to Medical Ultrasound Services. Legal disclaimer. The information in this presentation is for general and informational purposes only. Content is not nor intended to be a substitute for professional, legal, or clinical advice. While we strive to make the information as timely and accurate as possible, we make no claims, promises, or guarantees about the accuracy, completeness, or adequacy of the information contained, and expressly disclaim liability for errors and omissions. Course objectives. Students will be able to verbalize what medical ultrasound is. They'll be able to verbalize the historical development of medical ultrasound, the role of ultrasound in obstetrics and gynecology, and the different types of ultrasound used in obstetrics and gynecology. Why is this topic important? Medical ultrasound is a crucial topic for several reasons in the field of healthcare. It is important for its non-invasive nature, diagnostic capabilities across various medical fields, and role in prenatal care, cardiovascular imaging, procedural guidance, monitoring, portability, and cost-effectiveness. The continuous advancements in ultrasound technology further enhance its significance in modern healthcare. So I've been in the field for about 15 years as an ultrasound technologist, and I can't tell you how many changes I have seen in the technology. It's amazing. They keep finding new uses for ultrasound, more indications. They keep developing further high technology beyond anybody's understanding almost. It's amazing. What are medical ultrasound services? It's a safe and non-invasive imaging technology employing high-frequency sound waves that produce real-time images of internal body structures. It's widely used across medical fields. It aids in evaluating physiology, fetal health, and detecting abnormalities in organs and tissues. It's versatile, used for imaging various body parts and guiding procedures like biopsies. Recent advancements include 3D imaging and contrast-enhanced ultrasound. The use of ultrasound in medicine dates back to the period around and following World War II, with significant contributions from pioneers such as Dr. Karl Theodor Dusick in Austria in 1942. However, its historical roots can be traced even further back to Lazzaro Spallanzani's work in 1794, which laid the groundwork for medical ultrasound by studying sound waves' ability to locate objects. Dr. Dusick's research marked an early milestone in using ultrasound for medical purposes, followed by George Doring Ludwig's detection of gallstones in 1949 and Ian MacDonald's introduction of ultrasound in diagnostic medicine in 1956. That's pretty impressive that back in 1949 they were able to see or detect gallstones with ultrasound. That was pretty primitive ultrasound abilities, so it's pretty amazing. Ian Donald's contributions were particularly noteworthy, earning him the title the father of OB/GYN ultrasound for his work in visualizing abdominal tumors, cysts, and fetuses. The development of commercially available ultrasound systems from the mid-1960s further propelled its widespread adoption as a common medical imaging modality, marking a rich historical development marked by key figures and milestones. So the role of ultrasound in obstetrics is pretty significant. It aids in pregnancy confirmation. Ultrasound is often used to confirm the presence of a viable pregnancy and estimate the gestational age. Fetal development monitoring. It allows healthcare providers to monitor growth and development of the fetus. Measurements such as crown rump length, or CRL, biparietal diameter, BPD, and femur length help assess fetal age and detect potential abnormalities. Assessment of fetal anatomy. Detailed anatomical surveys, often performed during the second trimester, help identify any structural abnormalities in the fetus. It also looks at fetal well-being and helps with monitoring. Doppler ultrasound assesses blood flow in the umbilical cord and other vessels, helping to evaluate fetal well-being. It looks at multiple gestations. Ultrasound is crucial in managing multiple pregnancies, monitoring the growth of each fetus, and assessing potential complications. It helps with evaluating the amniotic fluid, helps in evaluating the volume and characteristics of amniotic fluid, which is essential for fetal development. It aids in guidance for invasive procedures, such as amniocentesis or chorionic villus sampling, to ensure accuracy and to minimize risks. So ultrasound is pretty useful in gynecology as well. It's used for pelvic imaging, to visualize the uterus, ovaries, and surrounding tissue, and pelvic structures, looking for abnormalities such as fibroids, cysts, or tumors, evaluating the reproductive organs and diagnosing conditions like endometriosis, polycystic ovarian syndrome, and uterine abnormalities. It helps to look at infertility. It aids in assessing the reproductive organs and identifying factors contributing to infertility. It helps with guiding procedures such as hysterosonography, saline infusion sonography, and ovarian cyst aspirations. It helps with monitoring ovarian follicles in assisted reproductive technologies, or ART. Ultrasound is used to monitor the development of ovarian follicles during fertility treatments and uterine abnormalities. It helps to identify uterine abnormalities such as septate or bicornuate uterus, which may impact fertility or cause complications during pregnancy. There's different types of ultrasound used in obstetrics and gynecology. Obstetrics ultrasound is used for confirming pregnancy, estimating gestational age, and monitoring fetal well-being. And in gynecological ultrasound or pelvic ultrasound, these types of ultrasound play a vital role in the diagnosis and management of conditions in obstetrics and gynecology, contributing to improved maternal and fetal care. So in conclusion, medical ultrasound is an imaging technology that uses high-frequency sound waves to visualize internal body structures. Medical ultrasound is a crucial topic for several reasons in the field of healthcare. It's important for its non-invasive nature, diagnostic capabilities across various medical fields, its role in prenatal care, cardiovascular imaging, procedural guidance, monitoring, and its portability and cost-effectiveness. The continuous advancements in ultrasound technology further enhance its significance in modern healthcare. The use of ultrasound in medicine began during and shortly after the Second World War in various centers around the world. The work of Dr. Karl Theodor Dusick in Austria in 1942 on transmission ultrasound investigation of the brain provides the first published work on medical ultrasonics. Ultrasound plays a crucial role in obstetrics and gynecology, providing valuable information for monitoring the health and development of the fetus during pregnancy, as well as diagnosing and managing various gynecological conditions. In both obstetrics and gynecology, advancements in ultrasound technology have improved imaging quality and diagnostic capabilities, contributing to better patient care and outcomes. Regular ultrasound examinations are a standard part of prenatal care and gynecological assessments, providing valuable information for healthcare professionals to make informed decisions regarding patient management.